NE-8 welcomes Dr. Pankaj Soni, MD Internal Medicine. He is a specialist in diabetes, dyslipidemia, obesity, and thyroid disorders, and is also experienced in treating infectious diseases. He is the Director, Senior Consultant, and Unit Head of Institute of Internal Medicine, Max Super Specialty Hospital, Saket, New Delhi. So we welcome Dr. Soni, and we would like you to enlighten us about various aspects pertaining to medicines with COVID-19. Dr. Soni, we have a lot of people going on a panic buying of even medicines. Some are suggesting that we take hydroxychloroquine, paracetamol as a means to, prepare ourselves, safeguard against COVID. What is your opinion? What is your advice?
I would suggest that this is the only first aid medicine that the people can start with. Whenever they have fever during this time, they can start with tablet of paracetamol, can be taken as frequently as every 4 hours, 6 hours, 8 hours or 12 hours depending on the need, only when the temperature is more than 100 degree Fahrenheit. If the temperature is less than 100 degree Fahrenheit, they should not take the tablet of paracetamol. Along with paracetamol, they need to take in plenty of fluids because this leads to a lot of dehydration when the fever is there. They should take rest. They should isolate themselves till they prove that they are COVID positive or COVID negative. So this is the status of paracetamol. I would still say paracetamol is a very essential drug and can be taken, but there is no need for hoarding of paracetamol. It's freely available, and I don't think we'll run out of supplies of paracetamol. So regarding the symptomatic treatment, I think paracetamol is a wonderful drug. Coming to your second drug, which is hydroxychloroquine, yes, hydroxychloroquine, has been a very controversial drug, where the Indian initial studies showed that yes, it is very beneficial in two ways. One is the preventive aspect, and some studies coming from Bombay say that the policemen who were on prophylaxis of hydroxychloroquine didn't suffer from COVID-19. So presently, the prophylaxis is basically meant for people at risk. So people at risk means either they are healthcare professionals who are delivering the healthcare, or people who are doing their jobs during this COVID-19 times, attending to the offices, like sanitary workers, sanitation workers, and the public transport systems. So these are the people who are at risk, and they are the people, the police personnel. These are the people who should be advised prophylactic use of hydroxychloroquine. Regarding the therapeutic use means that when you develop the disease, you take it as a part of treatment, right? So when that is there, again there were a lot of controversies. Initially, there were good results. We all were using hydroxychloroquine for 5 days. The results were very good. But then there were certain publications in Lancet and other journals, New England Journal of Medicine, where they said that the trials in the Western countries were not giving positive results. So the ICMR said, no, we will not use. But I think these are all continuously changing the guidelines. But I still feel that presently azithromycin along with hydroxychloroquine forms the first line of treatment for any COVID positive patient. I would say COVID positive. So that is very important. And they have to be used judiciously under supervision, right? Because their combination use of azithromycin with hydroxychloroquine or either of the two separately can have certain consequences, especially for people who are elderly, people who have cardiac issues, people who are taking cardiovascular medicines, because what they do is combination, it prolongs the QT interval. QT interval is the interval, the heart in the pulse generator mechanism of the heart. So what happens is people go into a slow heart rate, they can go into heart blocks. So this has to be taken under supervision, because most of the people who are hypertensive, who have heart disease, who have thyroid issues, or who are diabetic, they must be taking certain medications which can be dangerous when they are combined with these two medications. So therefore, I say that these drugs should be taken only under supervision and not without supervision.
So, doctor, what you're saying is there is no need to take any preventive medicine as such, except to treat the symptoms. In case
Yeah.
of
So so
temperature.
presently, yeah. So the presently the preventive strategies which are is basically how to keep your immune status good. And what we are doing is in preventive strategies are we are using vitamin C, 1000 milligram, 500 milligram morning evening. We are using zinconia tablet, which is zinc 50 milligram. We are advising people not to go outside, to do some sort of exercise at home, deep breathing exercises especially, and take good nutritious food. And so these are the preventive strategies. Some people say that even the homeopathic medications, certain are preventive. We don't have any trials or studies on them, but yes, people have used, and they say that it is a good preventive strategy.
So
So
best,
regarding prevention,
I
these
mean,
are
the
the only
best,
options.
okay, the best suggestion or advice would be to enhance the body resistance or health. What about taking vitamin D, vitamins, things like that? Does it help?
So, so yeah. So basically, most of the Indians, if you see, they are all deficient in vitamins, right? Because it is our lifestyle, the food availability, and the environmental changes which we have been living in the last 10 years. So most of us are deficient in B complex growth, vitamin C, vitamin D, and like even in normal health, we were also using vitamin E to increase the immune status. And even in as far as the food is concerned, we say um, 5 pieces of almonds and maybe 1 teaspoon of honey. So they are a very rich source of antioxidants and vitamin E. So they can also be to given to the
This,
children.
what about young children? I mean, is this the same advice you would give? That is to give them vitamins or
See, as such, the incidence of COVID-19 is very less in the younger population, right? So I would say young means teenagers. It's very less in teenagers and below that. And so I would still feel that they can be without the medications also. They can just be given a lot of fresh fruits which contain all vitamins, because the food that you cook on the gas or the burner, that it destroys the whole all the vitamins. So if you use plenty of fresh fruits, juices, green salads, that's a rich source of vitamins, especially to the younger population. But if you still feel one needs to give, I think vitamin C can be given safely in the younger
or
population.
you would advise natural source of vitamins rather than taking a
Yeah,
tablet.
see, because what happens is that most of the fresh fruits and raw vegetables used in salads, etc., have plenty of vitamins, and young people have no absorption defect, so their absorption is very good. So it suffices even if they are on that. In people who are in their late 20s, 30s, and 40s, their absorption is also not good. So these are the people who would need extra supplementation.
There is also advice from some sections who believe that having flu vaccine would also be a good idea. Is it? What do you say about flu vaccine?
There are reports that people who have been vaccinated for the influenza vaccine, the incidence of COVID-19 is less. But these are all anecdotal reports. So I think once over a period of next few months when this settles down, so then we'll have a better idea whether the flu vaccine was preventive or not.
What would be the best way of using disinfectants? Is it advisable to use sodium hypochlorite, spraying the
No, no,
area?
spraying is not advised because it has got its own side effects. So yes, but as a cleaning agent, Yes, if you make the appropriate dilution one then it's good, it kills the virus. And so it is known to kill the virus, there's no doubt about it. But just having those sprayers at entrances and everything, I think this policy has been now taken off. Even the government of India is not advising that. And so the best, I think, is hand sanitization and social distancing.
This community spread, as we call it, does it also promote or does it lead to herd immunity? I mean, what is your opinion about this?
See, that's how the immunity builds up, whether you call it as a herd immunity or it's the basic principle in vaccination. So, when you get a milder degree of infection or a subclinical infection, your body produces the antibodies, right? And that's how you get protected against a disease. So people who are exposed to when they are being exposed to more number of people will develop subclinical infection or a milder infection, which may be asymptomatic. They will never test for it, and they will develop their antibodies to it. So once the antibody testing comes up, then only we'll know how many, uh, what was the, how is the herd immunity going on. Because unless we test for the antibody, it's difficult to say about the herd.
What is your opinion about the testing, the means of testing? One, you have laboratory BSL. We have in Nagaland one BSL-3 laboratory, and now we also have TrueNat machines. And we often find that TrueNat machines always give negative test results, whereas BSL-3 laboratory, they give most of the positive results. Not
So
most.
see, every testing modality would have certain limitations and certain
So what is your
positivities.
take about the reliability of TrueNet machine, the portable ones,
I still believe in RT-PCR.
RT-PCR?
RT-PCR. So that is a more validated modality of testing. And in our hospital, we are doing RT-PCR, and we are quite satisfied with good results with RT-PCR.
So right now, what is your view? Whether India is going to see a further spike? Somebody was suggesting, estimating about 1 million in the next 2 to 3 months. That's about 10 lakh cases.
So I think in the last 10 days, we have seen a sudden spike in the number of patients. So I would feel that next 3 weeks will hold the answer as to where we will reach. So if we continue to take an ascending graph in the next 3 weeks, then we are headed for a major, huge number of patients. But if we plateau or see a decline in the next 3 weeks, so that would mean we are in a better position.
We have a lot of demand for sanitizers these days. In itself, are they also harmful or they are just harmless sanitizers?
So they are basically, most of them are alcohol based. That is the recommendation, 70% alcohol. And as far as harm is concerned, some people might have developed contact dermatitis when they are using on the hand. There could be rashes, redness, local irritation. And as far as local effect is concerned, that is the only effect. And some people are, storing these in their cars, and then some news about the alcohol catching fire because of the storage. So all these things have to be taken. But otherwise, as a for daily home use, I think it's a good sanitizer.
Is there any similarity between HIV and COVID? The way they,
Uh, yes, some of the uh, gene sequences, people who are doing the genetic sequence, they feel that there is similar sequencing in COVID-19. And that was the reason when the Chinese people started tweeting, and they used one of the medicines, rotenavir, to use against COVID-19. And even in India, when it started, you'll be aware that most of the first few cases were in Jaipur, and these were the Italian people who had come on a visit to India. And the Jaipur hospital did use the protease inhibitors, the anti-HIV medicine, to improve the condition, along with hydroxychloroquine and the azithromycin.
See, now we have relaxation to the point that everybody is allowed to move out. They say it's social distancing. But if you say go to a mall where you have a lot of people, even if you have social distancing, do you feel that the air, the environment dense with, supposing a few people are symptomatic, will it also harm those who don't have COVID?
Definitely, definitely. You're absolutely right. I don't think that this is the very right time for people to be, going to malls, cinema halls, and closed environmental spaces. Because even if when you look at hospital setups, where we have COVID positive patients, so I would presume that there is a community transmission. So most of us would be carrying this COVID virus in us, and we have the capability of giving it to other people, especially in closed environments, whether it is mall, restaurants, or the metro, such places. And because there is, the uh, air conditioning is such, the each shop doesn't have an individual air conditioning, it is centralized air conditioning. And there are certain norms, which all these malls need to follow regarding air conditioning. How many exchanges of air have to be done, in 24 hours. The old air from inside the malls has to be taken out, and fresh air has to be given in. So there are a lot of guidelines which have come up. We are not sure how much of these would be followed by the people who are operating the malls. And for general public, I would still say please stay away at least for 3 months.
So it's not a very wise advised for people to go out and do shopping
Yeah,
at
yeah, yeah, yeah,
there's
yeah.
no
Shopping, parlors.
others. Yes.
So if you look at the history of Spanish flu 100 years back, and a lot of literature is available on the internet about what happened during the flu, the survivors, their stories. So the whole thing boils down to isolation. People who remained indoors and didn't venture out, they survived the Spanish flu and lived to tell the tales of what happened. And people who were more heroic, didn't survive.
Some said that the COVID virus survives in the human body for 37 days. So now after you have your mandatory 14-day quarantine, they have tests, they say it's negative, so the person can go self quarantine. But how safe is it? Because if the virus remains in the body for 37 days, so
So what they have done is, like in South Korean study, they were totally rid of COVID after treatment. They tested negative, and then in the follow up, they again tested positive. So what they found out is that the in the nose there were certain remnants of the nucleic acid of the virus, and which was testing positive. So what actually it does is it just picks up the nucleic acid of the virus and then says whether it is positive or negative. So what the scientist came up with the explanation was that one could be that we are not able to differentiate between the dead and live virus. The second is that the viral load in patients who after 3 weeks is very low. And so what they say is that even patients, even if the virus lives inside the body for another, 10, 15 days more after 3 weeks, these patients become least infectious. The chances of giving infection are very, very low because they do not contain much of viral load.
the viral load is low, you mean to say.
So that is their take on this.
We have a lot of people in quarantine centers. and the capacity is already packed. So now what they want to do is they want to, release those people who have completed 14 days and
Yeah.
advise them to have quarantine. But now that is also not because of the medical point of view, but because of the what you call their management. They can't manage so many people.
Yeah, yeah. So these days, people, stable patients are being discharged even at an earlier stage. And but again, it has two flip sides to it. One, if the patient is afebrile, not running fever for past 3-4 days, these are the who are stable. Their oxygen saturations are normal. They can be discharged. But the only side is that most of the complications which happens in the COVID happens in from day 8 to 14. So that is the most crucial time, and these are the time when people need to be monitored. And what we have seen is that the patients who were in hospital and deteriorated, they fared better. They didn't have any mortality uh, in comparison to people who were at home and they deteriorated. So, ideally speaking, I would say that most of the people who are sick during the second week, they should be into the hospital and monitored.
But hospitals are also now having no more beds. We learn about certain hospitals in Delhi are refusing to take in patients. So even hospitals are also overflowing. So what?
See, I think there is a slight mismatch and imbalance. Most of the people do not want to go to the government facilities. Though, if you see on their WhatsApp and their, on their app, the beds are available in the government setup. But people are reluctant to go. They want to come to the private setup, and we have had instances where some of the bosses of the government hospitals have come to the private hospital for treatment of themselves. So there is certainly a lack of faith in the government hospital at the moment. Everybody wants to come into the private sector,
So I think
and because
there's a very good indication that the government hospitals need to be privatized.
they need to be improved. They need to be improved.
Privatization could be also one option.
Yeah. Or that PPP, they say that
Yeah,
public and private partnership.
that's true.
So I
So
think the government hospitals have such a good pool of doctors, and if they can just improve their the facilities that are being provided, the most of the public would love to go there.
people who are having other ailments, like for example, arthritis, asthma, and bronchitis, whatever, if they get COVID, especially the people who are 60 plus, are the chances of survival high or low, or what is your opinion?
So anybody who's above the age of 65, patient who has comorbid conditions like diabetes, patient who have heart disease, patient who have history of asthma, patients who are smokers. So these are people who are at risk, people who have cancers. So these are the people who are at risk, and definitely the mortality rate in these people is higher as compared to a normal person. So these are the people where the effort has to be put, and they should be given the best of the facilities. And it's not key they will not survive; they are chances of survival because even the at this even at their age with all these mortality morbidities, the mortality rate would be about 10 to 15%. So that's not a high.
So the people who are having sugar, heart, BP, they also stand at a high risk of
Yeah,
fatality.
yeah. So we have been getting a lot of patients who are coming into the emergency with diabetic ketoacidosis, right? So suddenly sugar is going out of control, excess ketones being produced. They are coming with shortness of breath, and most of them, 80% of them, are turning out to be COVID positive.
So for those people,
So people are coming with
what percentage of these
about
people,
80% are improving.
or 80%?
80% are improving.
Okay.
So 80% are improving. It's not. they have to come to the hospital. You know, they don't have to neglect them. So
So presently, after the COVID, what else do we
So
expect?
similarly, patient who has an underlying heart disease can come with symptoms of acute.
So after
It's
COVID,
very difficult to say.
what are the
I
others
think
you expect?
our expect our our expectation should be normalcy now, at least for a year, and we hope and pray that the Almighty gives us relief from COVID, and then
Supposing somebody was having suffering from this COVID, then gets infected with dengue or JE, will it be very critical?
double infections actually may are critical, and because dengue itself is sometimes can be life threatening because of the complications attached to it, and dealing with double infection is going to be difficult.
So anyway,
So
as
I
you
only hope that people do not suffer from two viral illnesses at the same time.
ultimately, what we can only hope is God Almighty will prevent the things from getting worse. Even doctors believe in God, and I think so. So anyway, doctor, it's been
Yes,
nice talking to you. I think
sure.
I've taken much of your time, and thank you so much for giving us much
My
time.
pleasure.
And
My
we'll keep in
pleasure. My
touch.
pleasure.
Thank you
Okay.
so much.
Bye bye. Bye
Bye.
bye.